Let's start with health care. Is this budget going to make a difference? Our ERs are intended to provide emergency medicine to people who have suffered heart attacks, strokes, or physical trauma for car crashes. But they're jammed with people who need access to a family doctor or nurse practitioner. Either they have no health care provider or they can't access their health care provider in a timely manner. So they have to visit the ER if they want personal, face-to-face, hands-on examination. Cette situation a repoussé les limites de ce que les gens peuvent endurer, à savoir attendre 14 heures ou plus aux urgences. Les gens abandonnent, rentrent chez eux et deviennent encore plus malades. D'autres décident de rester chez eux, de chercher leurs symptômes sur Google ou d'appeler le 811 pour savoir combien de temps ils doivent attendre avant de devoir absolument se rendre aux urgences. Mr. Speaker, people need an alternative to the ER. Ça ne prend pas la tête à Papineau pour comprendre ça. This budget should ensure there is an alternative in place. Where do you go when you actually need to see a doctor or a nurse practitioner rather than the ER? If you can't see your own doctor or you don't have one or you don't have a nurse practitioner. We need urgent care clinics in our hospitals and community health centers to solve this problem so New Brunswickers can access primary health care in a timely manner. This has been proposed countless times by physicians, by nurse practitioners, by heads of our ERs, and yet we haven't seen any fundamental movement on this. It will cost money, yes, but it's an investment in our people, Mr. Speaker, an investment. In terms of access to primary health care, Mr. Speaker, Liberals and Conservatives have been taking turns singing the praises of collaborative health care teams as a means to solve doctor shortages since when, Mr. Speaker? 2002. 2002. We've been talking about this. Yet neither has done anything substantive to transition primary health care services to collaborative care teams. This budget should achieve that, but it doesn't. Promises that collaborative care teams will solve the doctor shortage go back to health ministers Alvin Robichaud and Brad Green under Bernard Lord, Mike Murphy and Mary Schreier under Sean Graham, Madeleine Dubé and Ted Fleming under David Allward, Victor Boudreau and Benoit Bourque under Brian Gallant, Ted Fleming again under Premier Higgs, Dorothy Shepherd and Bruce Fitch under Premier Higgs. Mr. Speaker, that's 4 Liberal health ministers and 6 Tory ministers that have failed to deliver on the promise of collaborative health teams since 2002. The current minister is still talking about it, yet there appears to be nothing in this budget to truly make it a reality. You know, 8 years ago, Mr. Speaker, the Liberals promised to take 2,000 New Brunswickers off the waiting list for a doctor by creating a pilot project to have nurse practitioners working with family physicians. It was called the Enhanced Patient Access Primary Care Pilot Project. Nothing, absolutely nothing, ever came of it. Yet the waiting list for health care providers grew and grew and grew. Healthcare reform has become a process of perpetual pilot projects, Mr. Speaker, that get us absolutely nowhere. Where's the accountability, Mr. Speaker? Where is the accountability? Les équipes collaboratives de soins de santé augmenteront considérablement le nombre de personnes bénéficiant de fournisseurs de soins de santé, mais elles nécessitent un investissement financier dans la fourniture de soins de santé primaires. For example, fundamental, if there's one thing that this government could do through this budget, is to create a different funding model for nurse practitioners so they can actually work in collaborative healthcare teams, Mr. Speaker, so they can be reimbursed directly for their work. With the status quo, the family doctor must pay the wages of collaborating nurse practitioners from the income they receive from Medicare for their services as physicians. It's not sustainable. Or somehow they must convince the RHAs to put the nurse practitioners on payroll in the collaborative practice. This is the same situation for other health professionals, from dietitians to physiotherapists, except for pharmacists, Mr. Speaker. Government is now reimbursing pharmacists directly for the kind of work they do to diagnose and treat minor matters, minor illnesses. Not minor to the person who's suffering from them at the point, of course, but in the grand scheme of things, minor or manageable. So, Mr. Speaker, this budget needs to create a funding formula that ensures nurse practitioners and other allied health professionals can join family physicians in collaborative care teams to serve those currently without a primary health care provider. It really is the key, Mr. Speaker, that will unlock the development of, in the transition to primary collaborative care teams that will dominate, and solo physicians, healthcare providers will become much more in the minority. That's where we need to get to, Mr. Speaker, but this budget does not seem to address that fundamental need to provide an alternative funding model for nurse practitioners, Madam Speaker. Un budget axé sur le bien-être des gens du Nouveau-Brunswick garantirait que tout le monde ait des fournisseurs de soins de santé primaire et puisse avoir accès à des soins urgents en cas de besoin. Madam Speaker, a budget focused on the well-being of New Brunswickers would also have well-funded public health care to reduce the number of sick people in the system who are in need of diagnoses and treatment and rehabilitation, Madam Speaker. I don't see anything in this budget that makes preventative health care a priority.